I love to go hiking and participating in, fun runs and things like that.
Lisa Marie Potter is pretty active. She does a lot of her hikes while working as a freelance photographer.
We've gone through some pretty rough trails, and I was worried at the beginning that maybe that was a part of my life that was, going to change or come to an end.
Lisa Marie ruptured her right Achilles tendon on her way home from visiting family in England this past July.
I heard the gate number being called. I started to run, and within 2 steps, I heard a loud pop, and then it felt like an airbag had exploded under my heel.
She was taken to a local hospital where they put her in a cast so she could fly back to Arizona for surgery. Or, at least that's what she thought.
He showed me the MRI, and he was convinced that the surgery would be unnecessary. He tried to talk me off that ledge because I didn't believe him.
Lisa Marie went to OrthoArizona foot and ankle specialist Jason Lake.
There are very few surgeons that go online talking about not doing surgery for Achilles tendon ruptures, and part of that's because surgeons do surgery. And so patients do well when you fix Achilles tendon ruptures, but what we're learning is that patients can do well even if you don't fix them.
Dr. Lake said deciding whether to treat a patient the non-surgical way depends on the care they're given when the Achilles tendon rupture occurs.
So when they saw her in the ER, they put her in a splint that really flexed her ankle down, and where she ruptured her Achilles tendon, they kind of closed the gap, which is easy to do right away, but hard to do down the road.
Lake said because of this scenario, the healing process had already started, making Lisa Marie a great candidate.
Most of the times when I see an Achilles tendon rupture, they come from an ER or an urgent care. They were put in a splint that wasn't the type of splint that I would like, or they were put in a walking boot. They come to see me 5-10 days later. We do the surgery because now they've developed a big gap, and when I plantar flex or point the toes down, that gap doesn't really close up like I would like.
Lisa Marie's recovery process was like someone who had surgery. She went from a cast for a few weeks to a walking boot with wedges lodged inside to keep her toes pointed to the ground, and then she did physical therapy.
The first, week I was there, I couldn't lift the foot off the floor, and I couldn't even tilt it back. And, but with the massage treatments that he was doing on me, and the different exercises, it was amazing. Each week I could see the progress.
So we learned in the past that if you treat an Achilles tendon rupture without surgery and you keep them in a cast for 2 months, the tendon doesn't heal right. And there's been a lot of research about how the tendon fibers heal. And the key is to get the early motion and the early weight bearing, but without stretching it out.
Lisa Marie feels like things are almost back to where she was before the injury.
I go to the gym 5 times a week now. I can hike. I've got no sign that I've had a rupture to look at, and physically to get about. I'm feeling great.